I'm now excited to welcome our next two speakers. We have Farah Northcott, who is the Director of Healthy SBCSS at San Bernardino County Superintendent of Schools. Ms. Northcott's department is comprised of programs and initiatives, including CalFresh Healthy Living, California Health Education Framework, Mental Health Service Act, Children, Youth Behavioral Health Initiative, the Wellness Conference Connecting School, Family, and Community, and Tobacco Use Prevention Education. I'm not sure I could add any more. That's everything wellness in one job, so good luck with that, but that's exciting. Can't wait to hear about it. We also have Amrita Rai today, current role as Clinical Director of Community Behavioral Health, who focuses on supporting children and youth in Riverside and San Bernardino counties through mental health promotion and developing preventative and early intervention initiatives and programs. Through this work, she is leading the health plan's efforts in Student Behavioral Health Incentive Program, which is part of the Children and Youth Behavioral Health Initiative, a $4.6 billion investment in supporting behavioral health for California's children and their families. So we just want to give a sincere thank you from Santa Barbara County for joining us today, and we look forward to learning about your programs and partnership. Welcome.
All right, good morning, everybody. Again, my name is Farah Northcott, and I'm the Director of Healthy SBCSS at San Bernardino County Superintendent of Schools, and Amrita Rai will be joining us in a few minutes. And, let me say, our presentation is on the power of partnerships, elevating student wellness through managed care and education collaboration. And before we get started, I'd like to share a little bit about San Bernardino County. We're the largest geographic county in the nation. We have almost 400,000 students in our county, 600 school sites, and 33 districts and 58 charters, and we border 2 states. So it's very expansive, and we know that, as with any area, different regions have different challenges and unique needs due to enrollment, context of their area, and resources. And we are a very new department. We've been around for about 3 years or so, and we have a vision more recently realized in collaboration with our Assistant Superintendent, Dr. Stephanie Houston. But we have really been on a journey to find our footing, to find our identity, and actually delineate what is our strategy to best serve our county. And we don't want to be just a collection of teams working in silos. You heard that there's a lot of different teams within the department, but it would be easy for that to happen because a lot of our teams are grant funded. And with those grants, there's specific scope of work and deliverables, and it's easy just to focus on that. But how can we best serve our students holistically, serve our districts holistically? So one of the things we had to do is really look at the work that we're currently doing and what kind of reach do we have, and think about the impact of a few or impact of a many. And as you know, it's a large county. Where do we invest our time and resources? And how do we utilize and maximize our team? And do we bring food to the table in terms of direct services, or do we support districts so they can, quote unquote, do their own cooking? What are educators expected to do versus what they have control over? That's really important. And whether a school or district can have the best supports available to them based on their environment when they go home in their community. So we can discuss the importance of nutrition, but if they go to a food desert or food swamp, or their environment at home doesn't support that, what are we to do? We can teach about the dangers of vaping, but if there are smoke shops around their neighborhood, we know that that's going to increase the likelihood. So we view our work really as public health in the context of the education system. And we are addressing the social determinants of health, and that has become our focus. So the social, and I'm sure you've heard about this, but the social determinants of health are the conditions in which people are born, grow, live, work, and age. And there's specific factors, as you can see on this slide here. And we know that zip code is the greatest predictor of life expectancy. So then do we surmise that maybe zip code is a predictor of a child's educational outcomes? And just to share a little bit more about my department, the Healthy SBCSS department, we really do strive to impact health, whether it's behavioral health, physical health, mental health, and those students and their communities in our county. So as you heard, we have CalFresh Healthy Living, we have Tobacco Use Prevention Education, Children and Youth Behavioral Health Initiative, the Mental Health Services Act, and the California Health Education Framework. But really, we are focused on providing centralized support within all of those programs, building systems, bringing together cross-sector partners, working to achieve health equity, and providing training and technical assistance. And so we talk a lot about systems, and I want to do a little bit of a deep dive into our approach. And systems definition can be different things. So if you talk to several people, they might give you different definitions of what they believe a system is. So in order to best support our districts, we really believe that we need to support a systems approach. And so what we did as a department is we decided that we needed to define systems for what that meant to us internally and externally as we work with our districts. And so we created an activity and a process which all the voices were heard in our department, and we agreed upon our definition of system because it really was going to be the focus of our work. So we decided a system is a collective process to achieve a shared purpose. But we do have more questions to ask in the way that we do our work. Is it sustainable? Is it replicable across the county? Is it scalable across the county? And does it build capacity? And so I'd like to share a video with you, and I really believe that it could illustrate the systems work and how everything depends on another aspect of the ecosystem. How many people have seen this video? Does this look familiar to some people? Okay.
One of the most exciting scientific findings of the past half-century has been the discovery of widespread trophic cascades. A trophic cascade is an ecological process which starts at the top of the food chain and tumbles all the way down to the bottom. And the classic example is what happened in the Yellowstone National Park in the United States when wolves were reintroduced in 1995. Now, we all know that wolves kill various species of animals, but perhaps we're slightly less aware that they give life to many others. Before the wolves turned up, they'd been absent for 70 years, that the numbers of deer, because there was nothing to hunt them, had built up in the Yellowstone Park, and despite efforts by humans to control them, they'd managed to reduce much of the vegetation there to almost nothing. They'd just grazed it away. But as soon as the wolves arrived, even though they were few in number, they started to have the most remarkable effects. First, of course, they killed some of the deer, but that wasn't the major thing. Much more significantly, they radically changed the behavior of the deer. The deer started avoiding certain parts of the park, the places where they could be trapped most easily, particularly the valleys and the gorges. And immediately, those places started to regenerate. In some areas, the height of the trees quintupled in just 6 years. Bare valley sides quickly became forests of aspen and willow and cottonwood. And as soon as that happened, the birds started moving in. The number of songbirds and migratory birds started to increase greatly. The number of beavers started to increase because beavers like to eat the trees. And beavers, like wolves, are ecosystem engineers. They create niches for other species. And the dams they built in the rivers provided habitats for otters and muskrats and ducks and fish and reptiles and amphibians. the wolves killed coyotes. And as a result of that, the number of rabbits and mice began to rise, which meant more hawks, more weasels, more foxes, more badgers. Ravens and bald eagles came down to feed on the carrion that the wolves had left. Bears fed on it too, and their population began to rise as well, partly also because there were more berries growing on the regenerating shrubs. And the bears reinforced the impact of the wolves by killing some of the calves of the deer. But here's where it gets really interesting. The wolves changed the behavior of the rivers. They began to meander less. There was less erosion. The channels narrowed, more pools formed, more riffle sections, all of which were great for wildlife habitats. The rivers changed in response to the wolves. And the reason was that the regenerating forests stabilized the banks so that they collapsed less often, so that the rivers became more fixed in their course. Similarly, by driving the deer out of some places and the vegetation recovering on the valley sides, there was less soil erosion because the vegetation stabilized that as well. So the wolves, small in number, transformed not just the ecosystem of the Yellowstone National Park, this huge area of land, but also its physical geography.
And kind of improvise a little bit. But what came to your mind when you're thinking about the connections that can be made by just the action of introducing one new factor? How can what you saw really be translated into the work that we do and the ecosystem that we're trying to build? The interdependency.
I think that's what connections are, right? You start with one person and then eventually it creates a network that creates a bigger impact eventually. Sometimes we're not able to see it right away, but eventually we can see that. And we saw that in the video.
Thank you. So really it's that concept of 1 + 1 + 1 = 47. So really talking, thinking about what do wolves and Yosemite have to do with students and health. But as a department, we're really looking at an ecosystem. We're looking at a system that is mutually reinforcing for the benefit of students and families. So, but this can't be done alone. It really is the work of partnerships. And we at the county office do not have the capacity to be those direct service providers in all cases. And so we lean on our partners in order to be that mutually reinforced and contribute to that mutually reinforcing system. And that's why we believe 1 + 1 + 1 = 47, and that multiplier effect. So partnerships are not a new concept to anybody. We talk a lot about partnerships, but it's specifically about the way we engage and the structure in which we organize and how we facilitate. That's the key, being intentional about those. And this, I swear this is not math class. There's another concept that we try to visualize some of our concepts. So one of the things that we talk about at the county office is being that support for the 0 to 1 for districts. So helping them start that system, start their services, and introducing those partners so they can go 2 to 100. Because we aren't able to be that 2 to 100 for them in all cases. So we as a department live in that 0 to 1. And so this is another kind of concept that we in our journey are trying to work through. So in the past that we have been supporting school programs, district programs, but we're really trying to look towards more of an integrated approach where we can focus on the community as well and those partnerships. So what we want to do is really champion a self-sustainable system, which creates that system of support through that collaboration with various sectors, including managed healthcare, behavioral health, public health, and other community supports. So it really aims to build a network that is not dependent on external funding or support, but thrives through internal and community-based resources. So this is our integrated approach that we're striving for. I wanted to share a tool that we have. This is an internal tool. We don't share this with districts, but it's our district wellness profile. And we identified some key areas a while ago that we wanted to be able to keep track of, so to speak. And it's an evolving list. We've already changed this once, and we probably will change it again. But it really is a collection of data to understand where a district is at and maybe where they would like to improve some of their supports or maybe strategically abandon some areas that haven't been working. And one of the things that we're excited about is we're going to be partnering with our LCAP department, the Local Control Accountability Plan, to infuse their dashboard results along with the whole child district wellness profile. So that's going to be coming next year. So as we continue to focus on expanding and building our partnerships, I came across this spectrum, the collaboration spectrum, at another conference, and I really, really liked it. And this is something that we're taking a hard look at with our partnerships, because there are varying stages of partnerships. And I think it's important to identify where you are and identify what your goals are to understand where you should be or where you want to be on that spectrum. So as a department, we are going through our partnerships. This is more of a newer activity because we are a newer department. But what we're really doing is identifying our partnerships and then categorizing them, aligning with the WISC model. And one of some of the critical questions that we're asking are, what partners have been most effective in supporting our why? Are there any barriers or challenges that we face in accessing certain partners' services? In our county specifically, we have very, very remote districts and cities and very populated, dense cities. So naturally, the ones that are more urban, there's a lot of resources, and those that are far out, maybe like Barstow or Needles, they don't even have a grocery store in their community. So getting access to services is a real challenge. And then additionally, how can we improve our collaboration with existing partners, and what new partners should we be out on the lookout for? So really, that collective impact, that's also a term that a lot of us use, and I think it's really critical to focus on that collective impact and not random acts of partnership. I think some of the partnerships, sometimes if you're not careful, it can become maybe uncoordinated and random in that way. So really our work lies in coordinating and organizing the partners and resources to have that shared goal and shared impact and outcome. So we've done this in a variety of ways. I've highlighted a few different instances here. So we have the Whole Child Collaborative, and that is a collaborative that we started about a year and a half ago now, and it's comprised of law enforcement, public agencies like public health and Department of Behavioral Health, community-based organizations, and also districts. And really, we're coming together to build a brain trust around a problem of practice. And this year, we are going to be focusing on chronic absenteeism. And we are centering around the social determinants of health as well and creating work groups in order to address that problem collectively in our county with all of the partners at the table. We also really formed a solid partnership with the California School-Based Health Alliance. They are a statewide agency, and their goal is to enhance school-based health centers. And through that partnership, we started a coalition, the Inland Empire School Health Coalition, and that is a very strong coalition that has been about 2 years now in the making, and we have consistent attendance, and it really has reinvigorated our goals of having districts have school-based health centers to provide those services at school sites and districts. And so We just had a symposium a few weeks ago, over 200 people coming together to focus on that work. And also we started a podcast, and we have 2 episodes at the School Health Connection, and we are working on episode 3. And then additionally, we have the Wellness Conference, which it formerly was called the Southern Region Student Wellness Conference. We just gave it a brand new name this year, the Wellness Conference Connecting School, Family, and Community. It's been at Disneyland the past couple years in July. It's a multi-day conference. It's a result of a partnership with the Department of Behavioral Health. And really, the content strands that we offer are all centered around the WISC model. And we have had almost 1,000 attendees the past couple years. The call for presenters are coming out November 4th, so be on the lookout for that. And then also registration will be open at the beginning of the year. So our work really lives in coordinating the district's health systems, including maximizing the partners that are providing those services. And so without a doubt, we cannot do that work without our partners. And so now I'd like to introduce Amrita Rai from Inland Empire Health Plan to continue the presentation.
Good morning. Can you see me behind the podium? Farah's got a foot on me. I can't even see the monitor. I'm going to move. My mom's 4'9", so I tower by her. All right, so I appreciate the chance to be here today with you, and I'm from a small little health plan called Inland Empire Health Plan, and we are so perfectly situated as a community health plan because we are not in the rest of the state, we're not in the rest of the nation. We get to specifically care for our children, youth, adults, and older adults in Riverside and San Bernardino County. And as Farah mentioned, San Bernardino gifts us with some really interesting challenges. It's about 20,000 square miles. That's a big area. But 93% of our population live in about a 2,000 square mile area. 7% of our population are spread out in desolate and rural areas. And as a managed care plan, we are mandated by the state of California to bring forth equitable services as well as same access to services, regardless of where our members live. So we know, just like Farah said, we cannot do this alone. Especially because if you see the children and youth population that we have, it accounts for about 40% of our entire population. So what does that mean? As our kids grow, 40% of them are going to slowly turn into young adults and so on. So we have a vested interest in linking arms with whatever community resource, especially our County Office of Ed, that we can to actually make that collective impact. And we truly, truly live our mission in that we heal and inspire the human spirit, and we will not rest until all our members have optimal care and vibrant health. So I'm going to give you some context. So bear with me a little bit. This is going to be a little dry. So how many of you know what the Children and Youth Behavioral Health Initiative is? Okay. How many of you have heard of CalAIM? Okay. All right. So I'm going to give you a quick little lesson so we can build some context, and then I promise I'm going to get to the good stuff. So CYBHI is this unprecedented $4.6 billion 5-year initiative launched in 2021. It is authored and led by California Health and Human Services. And this phenomenal program brought together multiple regulatory stakeholders like the Department of Healthcare Access and Information, Department of Managed Healthcare, Department of Healthcare Services, and all the other alphabets you can think about. And all of these groups are there to lead and direct these multiple work streams. Well, the first work stream that kicked off was the Student Behavioral Health Incentive Program, SBHIP. How many find that acronym familiar? Okay. I'm seeing more hands on this side. Are you all with me? Okay. All right, so SBHIP was, I have to say, probably one of the most fulfilling programs that I have ever worked in my 25-year career. And it has taught me so much about partnership. And I'm going to shift from using the word partnership to relationship, because that changes kind of the dynamic and the sustainability in what we're trying to build. So CalAIM. CalAIM is this huge Medi-Cal managed care focused program. Now, CYBHI complements CalAIM. CYBHI launched in 2021, and the focus of CYBHI was specifically to increase and better mental health and substance use treatment for children and youth, removing systemic barriers regardless of payer. CalAIM focused on reinventing our whole Medi-Cal system, focusing on a population health management strategy. So the population health management strategy was a mandate regardless of Medi-Cal managed care plan. So any Medi-Cal managed care plan within the state of California had to move through CalAIM, and we're right in the midst of it, utilizing a population health management strategy. And all that pretty much means is that we're mandated to use data-driven approaches to make sure our members receive the right level of care by the right type of provider at the right time and at the right place. Broad, right? Huge and broad. So through the population health management strategy, and I'm getting there, through the population health management strategy, there were 3 bold goals that came out of this. Now, this is just not IHP. This is across all Medi-Cal managed care plans across the state. These 3 bold goals focus on maternal health and birth equity, behavioral health integration, and childhood preventive services. So are you seeing some of the linkages here with what you've already heard? So now comes the good part. How many of you have ever been or experienced love at first sight? All right, we've got 4. Whew. I was hoping we'd have few, because otherwise you would have totally messed up my whole point. So how many of you have experienced relationships that you've had to work on, that you've gone through ups and downs, and you have eventually figured out that there was some mutual benefit in maintaining this relationship and building it? Pretty much almost everyone in the room, except those lucky ones who just raised their hand there, love at first sight. So this is why I kind of shifted to relationship instead of partnership. Going back to SBHIP, in 2021, SBHIP introduced an incredible opportunity for us to begin our relationship with the County Office of Education. SBHIP was a 3-year, about $484 million incentive program, of which San Bernardino and Riverside County received about $50 million of it. And our mandate was to build relationships that were sustainable with our COE, as well as our local, our LEAs, or our school districts, and develop interventions. Now, SBHIP is going to sunset at the end of this year. I don't know what I'm going to do, because it's enveloped my life for the last 3 years. But if you look at this timeline, and you'll get these slides, so I'm not going to go into too much detail. There's a lot of words on here. But in 2021, I made a phone call, and it was to Dr. Stephanie Houston, our assistant superintendent at the San Bernardino County Office of Education. I didn't know her. She didn't know me. I didn't trust her. She probably didn't trust me. No reason to, right? And we started a conversation. I mean, I literally asked her, what is a COE? And can you please send me your structure? I have no idea what this looks like. Do you interact with the LEAs? What is an LEA? No idea. We didn't speak the same language. And she in turn asked me, she said, can you send me your structure of a Medi-Cal managed care plan? What do you do? So we started this conversation. Shortly after that call, I get an email from her. And she said, I'd like to have a meeting with you to talk about how we can enhance and deepen our relationship. Folks, that was incredible because that sparked friendship. And so if you look at the evolution, we started our friendship. We figured out that maybe there was some benefit to this. Then we decided to date. We actually had a couple ups and downs. I remember one time our IHP, myself, because I was blessed to lead this program, moved a little too fast and we made a misstep. And I remember calling Farah and Dr. Houston saying, oops, can you help us? And I remember Dr. Houston saying, you need to keep us engaged with this project because we know our LEAs. So I learned and I listened. And soon after we started dating, we got IHP, myself, several of my colleagues were asked to speak and present to various places that the COE was hosting. All of the key things that Farah had on a couple of slides about the California, the CSHA, California School Health Alliance, the Wellness Conference, IHP is at the table in every single one of those. So we started kind of integrating each other in our lives, which was incredible. And guess what, folks? We are going steady. We are committed. And that makes me so happy because once SB-HIP sunsets on December 31, 2024, my relationship with the County Office of Education, and by proxy of them, the school districts, because we've gained their trust, is going to continue. So what we decided to do was deliberately and intentionally move through our comfort zone. And I borrowed these slides from a wonderful keynote speaker who you're going to hear in a second. We had uncertainty, we had doubt. And you know what? It wasn't that either of us was doing anything wrong. It's not about that. It's about understanding that we could do things better together. Previous to SB-HIP, I usually said when I spoke at events or, with my team, it's these strengths that each of us have that we need to leverage. But since SB-HIP, I've shifted my thinking. When things happen in our society, when we lose children to suicide, when natural disasters happen, what happens? We come together as a community, right? It's that need that connects us. CYBHI was authored because of Gavin Newsom's master plan for kids. You heard, you've seen, you have felt, you've read about the crisis in mental health that our children and youth are facing. We are doing everything we can, but our systems are still disconnected. So we have the need. We're building on a blueprint, and that need is gonna bind us. So I ask you, who are your champions? What is your purpose? Because once you have that collective purpose, barriers are no match. Once you have that line of focus to what you want to do, once you build that relationship with your partners, barriers are no match. But you have to have that collective purpose. And the long game is so important for all of us to really keep in mind, because what we're doing right now could affect our kids, will affect our kids longitudinally. As a health plan who's focused on preventive measures, well child visits, immunizations, connecting with that primary care, did you know 7% or 7 cents of every dollar is spent on primary care? There was a new ruling or directive from the state a couple days ago that it's moving to 15% by 2033. So there is a huge investment happening with primary care. And primary care isn't just checking the box, right? It's about getting that child, that dyad, in front of a primary care provider so they can assess and identify things that could be coming up later as a chronic issue. I'm going to show you a video right now, and we're going to end with this. This is what happens when people come together for a collective purpose. We decided to go through SB HIP in a more relationship way. The state was not prescriptive. They basically said, here are millions of dollars, health plan. All you need to do is X, Y, and Z, and make sure you have sustainable relationships. Everyone figured out how to do that differently. At IHP, we wanted to lead with relationships, and it has been so fruitful to do it that way. And I'm so blessed and incredibly excited to see what we will continue to do. But when we launched SB HIP, we decided to do an event. And we wanted to bring people together. And we wanted to, in a very visible way, engage folks to be excited about what we're planning on doing for the next couple of years. And what you will see is the power of collective purpose.
I imagine a system where all of our wonderful individual providers and dedicated support staff and systems of care have the capacity to prevent behavioral health issues, address them early in terms of diagnosis, and treat them so that we have better outcomes when it comes to behavioral health in our children and youth.
We have had many conversations. It's time for us to act.
The Student Behavioral Health Incentive Program aims to enhance access to behavioral health services, early intervention, and prevention in or near school campuses, where the kids are.
This initiative is absolutely imperative so that kids that are going through some of the most traumatic times of their lives can actually have people connected to them that can actually make a difference, a real-world difference for their future trek and their future journeys in life.
By leveraging our resources together to reimagine and redesign our systems of care for our youth, we can ensure that the underserved are being served, that our community needs are being heard and being met.
Jonathan was dealing with stresses of us no longer having a home. A lot of us can't afford health care. So if we're not good, our children aren't good.
Trauma is so complex, and trauma has an accumulative impact on kids as they grow older to adolescence and adulthood. And SB HIP seeks to connect disconnected systems so that no child falls between the cracks.
These are real stories that are happening in our school districts and in our communities, but it would not be possible if it wasn't for all of you and your passion and your dedication to all of our students.
This is fully LEA's voice designing these programs, and they know what they need. What we're doing is building a sustainable infrastructure so that schools can offer these services, expand what they have, to improve access to preventive early intervention and behavioral health treatment for students K through 12.
We talked about leveraging resources. How does First Five fit in as a partner?
One of the things that we've been tasked to do is
increase access on or near schools. So that opens up an incredible opportunity to identify our community-based organizations like First Five and others around the schools that we're working with to engage them.
We can't exist in the silos that you all were talking about earlier, right? But transformation and solutions and innovation and beauty exists over in life's endless possibilities. It doesn't exist in our comfort zone. But it's because all of you drive me to know that we're right in thinking there is a better way to do this.
Why can't we make the world a better place for the children in this community? Why can't we break down that silo? Why can't we develop that partnership?
We're fully committed to continue to advocate and collaborate to make sure that the best supports are put in place for our students.
I believe that our students, our families, our community will be free at last from the burdens of trauma and all that comes with that.
And I know that support will continue as we develop this infrastructure and sustainability plan to support the behavioral and mental health needs of our students and their families.
IUHP is committed to engaging with our communities and partners to bring these new school-based interventions to life so kids like Jonathan can thrive and become amazing adults.
It's a game changer.
Well, I invite you to find your champions and create your relationships. Thank you.
Thank you, Farah, and thank you, Amrita. Did anybody notice a familiar face on that video? Dr. Takashi Wada. He grew an epic beard since the last time I saw him. That was pretty cool. But he used to be the Santa Barbara County Public Health Department director here in Santa Barbara County. So neat to see where he went. Anyone from SenCal in the room? No. I know that they've attended in past years. So, San Bernardino County talking about their health plan, Santa Barbara County, it is SenCal Health. And so I definitely encourage you to reach out and develop relationships with maybe some of those partners you may not traditionally think about. The other thing I want to say is, I didn't know until today, but I think that we all have the same spirit animal, and it is definitely the wolf. I was thinking about making you guys howl, but I'm not going to do that today. You're lucky, because we do have a break coming up. So I just want to thank you again for coming. What's really cool about your work is you see it as public health in the context of education, and you're addressing social determinants of health as well. So this integrated wellness approach, this idea that the approach combines school programs with community services and resources to create a united system that supports the overall health and well-being of students and families is so inspiring. And we know that that ultimately increases pupil engagement and outcomes and really creates some school success. So I just want to challenge you all to think about that integrated system and how you may move that forward in your own schools and communities. And also thanks for traveling. Santa Barbara County is not a terrible place to come visit, but we do appreciate you coming all that way and being with us today.